Hi, I'm Dr. Altaf, and today I want to share something that genuinely surprises a lot of people when they first hear it. If you've been told that fixing your blood sugar is mostly about cutting things out, cutting carbs, cutting sugar, cutting entire food groups, I want you to hear a different perspective today, because some of the most compelling research in blood sugar management isn't about elimination, it's about addition. It's about specific foods that have real, measurable effects on how your body handles glucose. And most people have never been told about them. Now, I want to be upfront with you from the start. These foods are not a cure. They're not a replacement for your medication or your doctor's advice. What they are is a genuinely evidence-based set of tools that, when added to a healthy lifestyle, can make a real difference to your metabolic health over time. Some of the research behind these foods is very strong. Some of it is promising but still early stage. I'm going to tell you which is which because I think you deserve honesty, not just enthusiasm. Let's get into it. The first food I want to talk about is fenugreek seeds. Fenugreek is something you might know as a cooking spice. It's common in South Asian and Middle Eastern cuisines, but researchers have been studying its effects on glucose metabolism for decades now. The most studied compound in fenugreek is called 4-hydroxyisoleucine. It's a rare amino acid, and early research suggests it may help stimulate insulin secretion from the pancreas in response to elevated blood sugar. The key word there is may. Most of this mechanistic work is from laboratory and animal studies, and we need more large-scale human trials to confirm exactly how well this translates in practice. What we do have from human studies is more interesting. Fenugreek seeds are loaded with a soluble fiber called galactomannan, which forms a gel in the gut and physically slows down the absorption of glucose after meals. And that part, the fiber effect, is well supported. There's a 2020 meta-analysis that found fenugreek supplementation was associated with reductions in fasting blood sugar, hemoglobin A1C, and LDL cholesterol. The effect sizes were meaningful, and the studies were generally well designed. This is genuinely encouraging data. Now, how do you actually use it? The most common approach in the research is soaking about a teaspoon of seeds overnight and drinking the water while chewing the seeds in the morning. Most studies use doses between 5 and 20 grams daily, but the right dose depends on whether you're using whole seeds, a powder, or an extract. Here's something I really want you to take seriously though. Fenugreek has meaningful blood sugar lowering effects, which means if you're already taking diabetes medications, combining them with fenugreek could push your blood sugar lower than intended. That's a real risk. Please speak with your doctor before adding fenugreek to your routine if you're on any diabetes medications. I'd also recommend avoiding it during pregnancy and exercising caution in breastfeeding since we don't have reliable safety data on whether its compounds pass through breast milk. There's also some evidence of cross-reactivity with peanut and soybean allergies, so if those apply to you, flag it with your doctor. Next up is cinnamon, and this one has a fascinating story. Cinnamon has been studied as a potential insulin sensitizer, and the interest here is genuine. The active compound most researchers focus on is cinnamaldehyde, which in laboratory studies has been shown to interact with insulin signaling pathways, specifically activating processes that help cells respond more efficiently to insulin. A helpful way to think about it, when you have insulin resistance, your cells essentially become sluggish at receiving insulin's message. Some early research suggests cinnamaldehyde may help those cellular receptors become more responsive. There's also evidence that cinnamon slows gastric emptying and inhibits certain digestive enzymes, which together can blunt post-meal glucose spikes. A 2024 meta-analysis covering 24 randomized controlled trials found that cinnamon supplementation was associated with modest reductions in fasting blood sugar and A1C, along with improvements in markers of insulin resistance. Modest. That word matters. This isn't a dramatic effect. But for something as simple and accessible as adding cinnamon to your diet, even a modest, consistent improvement is worth knowing about. The typical dose used in studies is around 1 to 2 grams per day, roughly half a teaspoon. One practical note, there are two main types of cinnamon available, Ceylon cinnamon and Cassia cinnamon. Cassia contains a compound called coumarin, which at high doses has been associated with liver stress. Ceylon cinnamon has much lower coumarin content and is generally the safer choice for regular supplementation. Whatever form you use, look for third-party tested products or supplements with GMP certification so you know you're getting what's on the label. And if you're on blood thinners, there's a potential interaction worth discussing with your pharmacist or physician before adding cinnamon supplements regularly. Let's talk about grass-fed beef, which might be the last thing you expected to hear in a video about blood sugar. Red meat has a complicated relationship with health headlines, and I want to be nuanced here rather than just cheerleading. Grass-fed beef does contain a higher concentration of omega-3 fatty acids compared to grain-fed beef, specifically alpha-linolenic acid and conjugated linoleic acid. There is some research suggesting these fats may contribute to improved insulin sensitivity, and CLA in particular has been studied for its effects on metabolic function. I want to be careful here though. Some sources draw a straight line between CLA and the effects of diabetes medications that target the same receptor pathway. That comparison is technically interesting, but it overstates the case significantly. Getting CLA from food is a very different thing in very different amounts than a pharmaceutical targeting that pathway. I don't want you to walk away thinking a serving of beef is equivalent to medication. It isn't. What I will say is that unprocessed red meat in reasonable amounts as part of a balanced diet rich in vegetables and fiber is not the villain it's sometimes made out to be. The research on processed red meat and health outcomes is more concerning. The research on unprocessed red meat is more nuanced. My general recommendation: if you enjoy red meat, choose unprocessed cuts, aim for grass-fed when you can, keep portions reasonable, and pair it with plenty of fiber-rich foods. That combination is where the genuine benefit lies. On the subject of healthy fats, avocados deserve their own moment here. Avocados are rich in oleic acid, a monounsaturated fat that has solid research behind its effects on lipid metabolism and insulin sensitivity. Oleic acid appears to help reduce liver fat accumulation, which matters because liver fat is a significant contributor to insulin resistance. Avocados are also a good source of potassium, which plays a role in cell membrane function and supports healthy insulin release. And perhaps most practically useful, a well-known study showed that adding half an avocado to a meal significantly extended feelings of fullness for 3 to 5 hours afterward. That satiety effect is underrated when it comes to blood sugar management. When you feel full, you eat less impulsively, you avoid sharp post-meal spikes, and you give your body time to process glucose properly. Now let's talk about broccoli sprouts, because this one genuinely impressed me when I first read the research. Broccoli sprouts are the young seedlings of broccoli plants, and they contain extraordinarily high levels of a compound called sulforaphane, somewhere between 20 and 100 times more than mature broccoli. That's a remarkable concentration difference. Sulforaphane activates a pathway in your body called NRF2, which is sometimes described as a master regulator of inflammation and oxidative stress. When NRF2 is activated, it triggers a cascade of protective gene expression in your cells, reducing inflammation, protecting mitochondria, and improving cellular efficiency. There's also emerging research suggesting sulforaphane may help reduce the liver's overproduction of glucose, a process called gluconeogenesis that's significantly elevated in people with type 2 diabetes. I want to be honest about the state of the evidence here. Much of this work is still in early-stage human trials or animal studies. The mechanisms are compelling, but large-scale randomized controlled trials specifically targeting broccoli sprout consumption in diabetic populations are still limited. What makes this worth including is that the safety profile is excellent, the food itself is inexpensive and accessible, and the theoretical basis for its effects is genuinely solid science. Around half a cup of fresh raw broccoli sprouts daily is the amount most often referenced in research. The key is consistency. Since sulforaphane has a short half-life in the body, chia seeds are next, and their mechanism is actually quite elegant. When chia seeds absorb water, they form a thick, viscous gel. When you eat chia seeds in a smoothie, mixed into yogurt, soaked overnight, that gel forms in your digestive system and physically slows down the rate at which carbohydrates are broken down and absorbed. The glucose still enters your bloodstream. It just enters more gradually, which prevents those sharp post-meal spikes. Think of it as a speed reducer on the glucose highway. Chia seeds are also one of the better plant-based sources of alpha-linolenic acid, an omega-3 fatty acid. A recent meta-analysis covering over 200 participants found that chia seed consumption was associated with meaningful reductions in C-reactive protein, a key marker of inflammation. And reducing chronic inflammation is central to improving insulin sensitivity over time. Let's talk about eggs, because few foods have been more unfairly caught in the middle of nutrition debates. The concern about eggs historically centered on their cholesterol content. Current research has significantly revised that picture. For most healthy adults, dietary cholesterol from eggs has a much smaller effect on blood cholesterol than once believed. The picture is more nuanced for people with existing cardiovascular disease or type 2 diabetes, which is worth discussing with your physician if that applies to you. What eggs do offer is impressive. They're one of the most nutrient-dense foods available. They're rich in protein, and they contain 2 micronutrients that matter specifically for blood sugar management. The first is choline, which supports fat transport out of the liver, and reducing liver fat is consistently linked with improved insulin sensitivity. The second is leucine, an amino acid that's particularly effective at stimulating lean muscle protein synthesis. This matters because skeletal muscle is one of the primary tissues responsible for clearing glucose from the bloodstream. The more lean muscle mass you have, the more effectively your body handles blood sugar. It's one of the reasons that strength training has such powerful metabolic effects. For most people, 1 to 2 eggs per day fits comfortably within a healthy dietary pattern. If you have concerns specific to your cardiovascular history, that's a conversation worth having with your doctor. Fatty fish, salmon, mackerel, sardines, trout is one of the most reliably supported foods in this entire list, and the evidence is strong. Fatty fish is the best dietary source of EPA and DHA, the 2 omega-3 fatty acids that have the most robust research behind them. These aren't just passive dietary fats. EPA and DHA are biologically active compounds that directly influence inflammation at a cellular level. Chronic low-grade inflammation is one of the most well-established drivers of insulin resistance. As inflammation decreases, cells become more responsive to insulin. The mechanism here is well studied, and the clinical data backs it up. A randomized controlled trial found that participants consuming high amounts of fatty fish, roughly 750 grams per week, for 8 weeks showed significant improvements in post-meal glucose regulation compared to a control group. The practical takeaway is simple. Aim for fatty fish 2 to 3 times per week. Canned sardines and mackerel are among the most affordable and convenient options, and their omega-3 content is comparable to fresh fish. Walnuts are fascinating for a specific reason that most people don't know about. Walnuts are one of the few foods that consistently show increases in adiponectin, a hormone produced by fat cells that plays a central role in insulin sensitivity and glucose regulation. Low adiponectin levels are strongly associated with insulin resistance and type 2 diabetes. A randomized controlled trial found that 16 weeks of daily walnut consumption improved adiponectin levels and fasting glucose in participants. Walnuts are also rich in magnesium, which supports insulin receptor function, and alpha-linolenic acid, which helps stabilize cell membranes around those receptors. A small handful of walnuts, around 28 grams, is a reasonable daily amount that aligns with most research. They make a genuinely useful snack because they're filling, portable, and require no preparation. The last food on this list is chickpeas, and they work on blood sugar through multiple pathways simultaneously. Chickpeas contain a type of resistant starch called amylose, which is digested much more slowly than the rapidly digestible starches found in white bread or processed foods. This slows the release of glucose into the bloodstream and blunts post-meal spikes. But what makes chickpeas particularly interesting is their fermentable fiber content. Your gut bacteria ferment this fiber and produce short-chain fatty acids, including one called butyrate. Butyrate strengthens the gut lining, reduces inflammation, and activates an enzyme called AMPK that prompts your body to use glucose more efficiently at a cellular level. The gut-metabolic connection in blood sugar management is genuinely one of the more exciting frontiers in current research, and chickpeas are one of the most practical ways to support it. Incorporating chickpeas into your meals a few times a week, in salads, soups, stews, or as hummus, is a realistic, sustainable habit with good evidence behind it. So that's 10 foods, each with real research behind them, each offering something meaningful to your metabolic health. Let me leave you with the bigger picture before I go. None of these foods work in isolation. The evidence for all of them is strongest when they're part of an overall dietary pattern that's rich in whole foods, fiber, and vegetables, combined with regular physical activity, adequate sleep, and appropriate medical care if you need it. If you have type 2 diabetes, prediabetes, or any concerns about your blood sugar, please work with your healthcare provider before making major dietary changes. Some of these foods, particularly fenugreek, have real interactions with diabetes medications, and you want those adjustments happening with your doctor's knowledge, not around it. But here's what I genuinely believe. Food is powerful, not magic, powerful. And understanding what the research actually says, rather than what gets exaggerated in headlines, puts you in a much stronger position to make choices that genuinely help you. That's what this channel is about. If you found this useful, I'd love for you to subscribe to Dr. Altaf's channel. I put out new videos regularly on evidence-based health topics just like this one. Practical, honest, and always grounded in the science. Hit subscribe and I'll see you in the next one.